Hi everyone, Amy Stein here again from Beyond Basics Physical Therapy here in New York City. And I once again have the honor of having Caroline do a series of videos with me on her experience with pelvic floor physical therapy and her journey, her healing journey, which has been the last video explained her journey and how she ended up healing and the experience of seeing over 20 practitioners for her condition. But she is here today to tell you that she's doing really well. And we would love for you to share any of the video series and you will win either one of my Heal Pelvic Pain books or the video Healing Pelvic and Abdominal Pain. They are both very good self-care guides towards healing your pain. And I did want to mention one other thing. If you are interested in learning more about pelvic health in general, we do offer a free Pelvic Health 101 series in the fall and spring of each year. They usually are on a Wednesday or Thursday night for 1 hour, and they are free in our Midtown location. And again, Caroline was a patient here years ago, and she's doing really well. She is currently a MBA student at Columbia, and we're going to continue this series by asking what specifically the physical therapy entailed and how you felt about going to the physical therapy, because I know that's a big question that patients ask, like what exactly do you do and how long does it take, which is very individual. Some patients we do see with pain conditions we typically see for 6 to 7 months, maybe longer. In Caroline's case, because it was such a journey of first that she had the symptoms so long, but then the journey with the physicians and where to go and who to see, it did take longer, but very successful story. So tell our listeners how your experience with physical therapy was, and then also, did you end up seeing other physical therapists? I can't remember.
Yeah, definitely. So actually when I was first referred by the urologist to do physical therapy, and they had specifically recommended Beyond Basics, but Beyond Basics wasn't as convenient to where I was living, and so I assumed when he said physical therapy, it was just any kind of physical therapy. So I actually started first going to a sports physical therapist, and then went back to him and was like, you know, it's helping, but not as much as you seem to think it was helping. He was like, no, like Beyond Basics is a very specific type of physical therapy. And so when I first came here, it was great because, you know, a lot of sports physical therapists, they might be able to help for different medical conditions, including when I had endometriosis. What was great about Beyond Basics team is the specialty in pelvic pain and having so many patients, you know, practitioners who understand that. And so I guess I think most of my sessions were around 45 minutes or an hour long, and I think every session was a little bit different based on what my symptoms and how I was feeling. You know, a combination, one of the great things, a lot of the practitioners here have different skills, and so I think one of the things I did was like cranio, which I found offered a ton of relief for me, especially when I was having indigestion or bloating, biofeedback I did a little bit in the beginning, which was helpful. And so I think it was so interesting after actually starting doing more of the sports physical therapy and moving here was great because it offered a lot of the same relief that it did regular physical therapy does, but then in addition, just I think being able to focus on the areas, you know, with pelvic pain and also just the knowledge, I think, here at Beyond Basics and the community they have. They know so many, Amy and her team knows so many different people in the community that specialize in pelvic pain. So in addition to just physical therapy offering a lot of relief. I thought it was great from the network perspective of learning who else is out there, who else I should be seeing in terms of doctors. And initially I think in the last series I talked about my journey and seeing many different doctors, and I think you guys were helpful in terms of kind of helping tailor that and help make sure I'm seeing, in each specialty, the doctors that really know pelvic pain. So I think in addition to actually the actual therapy you're doing, having that network was tremendously helpful.
Yes, agreed. The multidisciplinary approach for pelvic pain in general, and specifically endometriosis, which was what Caroline had, that is really key and important to pretty much anyone's rehab. Sometimes it can just be straight physical therapy, pelvic floor physical therapy specifically, but sometimes it does require a multidisciplinary approach.
Yeah, and one of the things I think was great too is you guys would kind of tailor the session each time based on, sometimes I would tell Amy I did this workout class and, I don't know what's going on, all of a sudden I've totally flared up, and so I think you practiced did cupping a couple times, which also offered some relief too, and based, I think, on what my symptoms are, teaching me a home program that was then helpful to do at home to make sure, when I wasn't coming, once or twice a week, that I was managing my pain on my own. And, I think guidance on the workout classes and exercise and the things to be doing was really helpful too.
Did you ever, throughout the sessions, throughout the treatment that you had, I actually know this answer, but I want you guys to hear it. Did you ever have any soreness from the physical therapy or any flares from the physical therapy?
Yeah, so sometimes afterwards I would feel very sore, and I remember sometimes I would email Amy being like, what's going on? I almost feel more bloated or more sore, and then a few days later I would feel great. So I think sometimes after one of the great sessions where the areas that I needed worked on, I would feel sore, and then I learned that that's actually normal and part of the process.
Yeah, and we've had experience with patients where we have actually flared their symptoms, and then what we do, just so you guys are aware, that you should speak to your physical therapist about it, communicate, and tell them that my symptoms flared. And what we do is we would just go back, look to see what we did specifically, and we would modify our treatment, because you do not want to flare after every session. That defeats the purpose. But if you do have soreness, that's typical. That's the soreness you actually want to have, or you may have some soreness because of tight muscles and tight tissue, but that gets better over time, right?
Definitely.
And then a good point about the exercise, everyone also responds differently to exercise. So for you, I think you had been doing the elliptical and that was fine. Tried a new exercise which involved a lot of hip strengthening, and at the moment it wasn't
great.
Wasn't so good. Yeah. But we went back and we looked at what was going on, and understanding various exercise classes, I was like, oh, that's a lot of hip rotation. That's definitely could flare you. So.
I guess I'll add one more thing too, is I think here Amy's really great about kind of looking at patients and thinking oh, okay, what you have, who's best to treat. So even though I saw Amy religiously, there have been times where she's like, what, I actually think you should see, Corey about this thing, because she has background on this specific, type of things. I feel like as a team they really, and then they communicate here, if you end up seeing a different practitioner at Beyond Basics, they're really in the know as to everything that's going on and have diligent notes, which is really nice, because one of the things I found very frustrating, especially going from doctor to doctor, is having to retell my story, retell my symptoms, and so I think you guys made a very seamless kind of approach for patients.
Yes. Yeah, we try, because we realize that most of the patients have had quite a journey with seeing various physicians and healthcare providers, and they're frustrated and they feel hopeless. And so we try to bridge that gap between the physical therapy and the other healthcare providers, as well as within our own practice. And what Caroline was mentioning is that we do have, most of us do treat similarly, but some of us definitely have different skill sets. And Corey and a couple other physical therapists here, they specialize in visceral mobilization, that is very specific, and it can help very much with endometriosis and various even nerve conditions. There's a neural mobilization that we're taught that you could take classes on. All of it's postgraduate, so it's a lot of training, but we do a lot of training in-house here and a lot of training out, and then we teach each other, and then in Caroline's case, I felt like I was, at certain points, I was hitting like a roadblock, so then I would ask one of the other practitioners, can you have a look? Can you treat her a couple times? Which is what she mentioned is very helpful. And then one more thing I wanted to add, because people do ask what biofeedback is. Biofeedback can be with the machine, and it actually shows what's going on with the pelvic floor muscles. You can also just use a mirror. We have patients, we teach them how to use a mirror at home to learn how to relax the pelvic floor muscles. One of the biggest exercises, and Caroline probably got sick of me talking about all the time, was just deep breathing and try to let go of the pelvic floor and relax the abdominal muscles. We give the patients various massages to do, which we'll get into in a different video series of what worked for her at home. So thank you so much for listening in, and again, please share our video, and you can be eligible for one of either the book or the video. And also check us out on our social media at Beyond Basics PT, and our website has a lot of great information for various conditions, beyondbasicsphysicaltherapy.com. Thank you again, and stay tuned for the next series.